I'm Miss Hart, Company's Commander, Captain Badger, who is in charge of the medical team safety during your stay in San Fernando. Nice to meet you.
Oh, every time I see you, 그대 눈을 볼 때면 자꾸 가슴이 또 설레어와 내 운명이죠. 세상 끝이라도 지켜주고 싶은 단 한 사람.
Copy, sir, copy. I will call the company right away. Captain, we had a call from the commander that someone is trying to ambush our base.
Call someone to protect our team and meet me downstairs.
Copy.
And you, inform our medical team, okay?
Place a clean cloth on the wound. Press the bandage firmly with your palm to control the bleeding. Maintain pressure by binding the wound with a clean cloth.
Hello? Andrew speaking. Your Honor, reader.
Captain Badger has been stabbed on his left upper chest. I already controlled the bleeding, but there is still a lot of blood loss.
He is also experiencing severe shortness of breath and rapid shallow breathing, so I provided him a brown bag so he can breathe properly.
Another thing, this guy right here is a consistent 10-year smoker and he has not yet received his COVID-19 vaccination.
You're ready here. Please stand by.
Okay, that's noted.
The patient is having increase of breath per minute, wheezing, grunting, and bluish discoloration.
What are his vital signs?
The patient's vital signs are unstable. The respiratory rate is 25. The heart rate is 120. The temperature is 40 and the oxygen stat is 85%.
Assist for supplemental oxygen. Call the imaging department. Prepare for X-ray.
Hello, this is the emergency department. Is this the imaging department? Okay, we have patient for X-ray.
The patient was stabbed in his left upper chest and the results of the X-ray revealed that he has a pneumothorax, which explains why he is suffering from acute respiratory distress. Acute Respiratory Distress Syndrome, or ARDS, is a life-threatening condition where the lungs cannot provide the body's vital organs with enough oxygen. It's usually a complication of a serious existing health condition. This means most people are already in the hospital by the time they develop ARDS. This is what happened to our patient who is a military captain, and due to his line of work, he is exposed with toxic chemical gases such as bombs, mines, and spray tanks. Additionally, he is an habitual smoker and has not yet received his vaccination, which contribute to worsen his condition. He will now be transferred to the intensive care unit and get mechanical ventilation. Thoracentesis will be performed by the doctor. The early and accurate diagnosis of pneumothorax in ARDS patient is mandatory, since this complication carries an increased mortality. This is the reason why pneumothorax must always be suspected in any patient with ARDS who experiences an acute worsening in respiratory function, accompanied with dyspnea and hypoxemia, which is usually unresponded to oxygen therapy.
The patient is in need of NGT for fluid and nutrient supply.
Hello? Hello? How are you? I'm sorry I can't be with you. I still have patients to take care of. I know the nurse is taking care of you.
Yes, the nurse always monitor my vital signs and gives me my medication on time. I heard it's an antibiotics. The nurse also just left after cleaning my wound. She also provided some health teachings on how should I take care of myself, on how smoking worsens my condition, just like what you always say. So I'll try my best to cut down my smoking habit and to be cautious of my surroundings. I miss you. See you soon.